Welcome to the deep dive. Today we're going to be talking about how doctors manage hyperthyroidism during pregnancy.
Ooh, that's a good one.
It is a good one. We're using the up-to-date article, Hyperthyroidism During Pregnancy Treatment. And this is a resource that is specifically for medical professionals. Now, before we get started, I just want to remind everyone that this is not medical advice. This is all about understanding the fascinating complexities that doctors face when treating this condition.
Right. You could say that we're like solving a medical mystery together.
Exactly. So let's unpack this. Can you just explain to our listeners what hyperthyroidism is and what causes it during pregnancy?
Yeah. So in the most basic terms, hyperthyroidism means your thyroid gland, the butterfly-shaped gland in your neck, it's working overtime. It's just producing way too many hormones.
Okay.
Now, this can lead to a whole bunch of symptoms: rapid heartbeat, weight loss, feeling hot all the time, and even anxiety.
Oh, wow.
During pregnancy, the most common causes are Graves' disease and something called HCG-mediated hyperthyroidism.
HCG-mediated hyperthyroidism. So HCG, that's the pregnancy hormone, right?
It is.
So does this mean that every pregnant woman experiences hyperthyroidism?
No, not at all.
Okay.
In fact, HCG-mediated hyperthyroidism is usually pretty mild, and it often goes away on its own as the pregnancy progresses. It's like a little blip on the radar.
Oh, that's reassuring to know.
Yes.
But what about the cases when it's more than just a blip? Is treatment always necessary?
That's where it gets tricky. Doctors have to very carefully consider the severity of the hyperthyroidism and weigh the potential risks and benefits of treatment
Okay.
for both the mother and the developing baby. Sometimes, if the case is mild and it's not really causing any noticeable symptoms, they might just decide to monitor the situation closely.
So it's not like a one-size-fits-all approach.
Not at all.
But when treatment is needed, what options are available?
Well, the go-to treatment for hyperthyroidism during pregnancy is a class of medications called thionamides.
Thionamides.
Thionamides, yes. You can think of them like a thermostat for your thyroid. They essentially dial down the production of those overactive hormones.
Oh, I like that. A thermostat for your thyroid. It makes it so much easier to understand.
It does.
So tell me more about these thionamides. What are they exactly and how do they work?
Sure. There are two main thionamides that are used to treat hyperthyroidism during pregnancy: Propylthiouracil, or PTU, and Methimazole, also known as MMI.
Okay.
They both work by basically preventing the thyroid gland from producing too much thyroid hormone.
So PTU and MMI, are they interchangeable or do doctors prefer one over the other?
That's a great question, and it's where things get really interesting. You see, choosing between PTU and MMI isn't as simple as it might seem.
Okay.
It's almost like doctors have to choose the lesser of two evils, you could say, carefully weighing the risks of each drug at different stages of pregnancy.
Wow. That sounds complicated.
Yeah.
What are the risks involved?
Well, historically, PTU was the preferred choice throughout pregnancy because of concerns that MMI might cause birth defects. But more recent data has revealed some pretty alarming cases of severe liver damage linked to PTU use.
Oh, no.
So the thinking has shifted a little bit.
So it's a dilemma for doctors then.
It certainly is. And to make it even more complex, the preferred choice actually changes depending on how far along the pregnancy is.
Oh, okay. Okay, this is fascinating. I'm getting a bit lost here.
Yeah.
Can you walk us through how this choice plays out over the course of the pregnancy?
Absolutely. So think of it this way. Doctors will start with PTU in the first trimester
Yeah.
to minimize the risk of those potential birth defects during those really critical early stages of development. Then after the first trimester, they typically switch over to MMI,
Okay.
which has a better safety profile for the mother's liver in the long run.
So it's like a tag team approach.
Yeah.
Each medication playing a specific role at different points in the pregnancy.
Exactly. It's all about minimizing risks for both the mother and the baby at every stage, and it doesn't stop there. Dosage adjustments are crucial throughout the entire pregnancy to make sure that the mother's thyroid hormone levels are just right.
Just right. What does just right even mean in this situation? I imagine it's not as simple as just getting those levels back to normal, right?
You're right, it's not. So here's the thing. The goal is actually to keep the mother's thyroid hormone levels slightly above normal.
Above normal, why would you want to do that?
I know it might sound a little counterintuitive, but it's all about protecting the baby. You see, a fetus relies on its mother's thyroid hormones for its own growth and development,
Right.
especially brain development during those early stages. So keeping the mother's levels a bit high ensures that the baby is getting enough thyroid hormone and doesn't develop hypothyroidism.
Ah. So it's like a delicate dance, making sure that both the mother and the baby have the right amount of thyroid hormone at all times.
Exactly. And to make sure they're both doing well, regular monitoring of the mother's thyroid function is really essential throughout the pregnancy. But what's interesting is that this monitoring doesn't stop at delivery. Hyperthyroidism can worsen or even come back after the baby is born, particularly in those first few months postpartum.
So it's really a long-term commitment, both for the patient and the doctor. Now, I know we focus a lot on thionamides, but are there any other treatment options available? What about surgery, for instance?
Yeah, surgery to remove part or all of the thyroid is definitely an option, but it's very rarely needed during pregnancy. It's typically reserved for cases where thionamides aren't working or can't be tolerated for some reason.
Okay. What about radioiodine therapy?
Oh.
I know that's used to treat hyperthyroidism in people who aren't pregnant.
Radioiodine is absolutely contraindicated during pregnancy.
Okay.
It can actually damage the developing baby's thyroid gland, so it's a complete no-go in this situation.
That makes sense. So it seems like thiamides are the real workhorses when it comes to treating hyperthyroidism during pregnancy.
Hmm.
Now, we've talked a lot about how the mother's condition is managed, but what about the baby? Is it possible for the fetus to develop hyperthyroidism?
It is possible, although thankfully it's rare.
Okay.
Remember those antibodies we talked about earlier? Well, in some cases, they can cross the placenta from the mother to the fetus and cause the baby to develop hyperthyroidism as well,
Oh, wow.
like a domino effect.
That sounds concerning. How do doctors even know if that's happening? Are there any warning signs?
Well, that's where that close monitoring comes into play again. Doctors use fetal heart rate monitoring and ultrasounds to look for signs of fetal hyperthyroidism.
Okay.
A rapid heart rate or an enlarged thyroid gland in the baby would be red flags.
So those prenatal checkups are really important for catching any potential problems early on.
Yeah.
What happens if they DO find signs of fetal hyperthyroidism? How is that treated?
Believe it or not, the mother can actually be given thionamides to treat the baby's hyperthyroidism,
Oh.
even if her own thyroid levels are normal.
Right.
It's pretty amazing how interconnected their systems are.
That is incredible. It's like a 2-for-1 treatment.
Mhm.
So even after the baby is born, it sounds like the mother's hyperthyroidism or the potential for relapse could still impact her life, especially if she's breastfeeding.
Right.
What happens then?
You're bringing up a really important point. So both PTU and MMI can be used while breastfeeding.
Okay.
But again, there are some nuances to consider.
Oh, boy. Here we go with the nuances again.
Yeah. So while PTU is generally considered safe during breastfeeding, that concern about potential liver toxicity still lingers. So MMI is often the preferred choice in this situation.
Okay, so the potential risks of PTU, even though rare, are still a factor in decision-making even after pregnancy.
Exactly. And even though MMI is considered safe for breastfeeding, doctors might recommend monitoring the infant's thyroid function just to be on the safe side.
Yeah.
It's all about taking every precaution to protect the baby while ensuring that the mother gets the treatment she needs.
It's fascinating how the mother's and baby's health are so intertwined even after birth. Now, our deep dive has focused mainly on medications and surgery as treatment options. But I'm curious, are there other approaches that women with hyperthyroidism during pregnancy might consider? What about things like lifestyle modifications or alternative therapies? Well, some women might explore complementary therapies to help manage their symptoms.
Yeah, things like acupuncture, dietary changes, or stress reduction techniques, those can be really helpful for overall well-being.
But I imagine those shouldn't replace conventional medical treatment, right?
Right, exactly. It's really crucial to remember that complementary therapies should always be discussed with a healthcare provider and used in conjunction with, not instead of, recommended medical treatments. It's all about finding a balance and what works best for each individual in consultation with their doctor.
So to recap for our listener, it sounds like managing hyperthyroidism during pregnancy is quite a complex journey. Doctors have to carefully weigh the risks and benefits of different treatment options, keep a close eye on both the mother and the baby's health, and maintain open communication with the patient throughout the entire process. It's quite a balancing act.
It really is. And it highlights the incredible expertise and dedication of the medical professionals who care for pregnant women with this condition. They're constantly striving to make informed decisions that prioritize the well-being of both the mother and her baby.
Absolutely. And speaking of staying informed, our source material for this deep dive was the up-to-date article titled Hyperthyroidism During Pregnancy Treatment, which is a resource specifically for medical professionals. So while we've covered a lot of ground today, it's important to remember that this is just a glimpse into a complex medical topic.
Yeah, that's an important point. This deep dive is meant to be informative and thought-provoking, but it's not a substitute for personalized medical advice. If you or someone you know is dealing with hyperthyroidism during pregnancy, the best course of action is always to consult with a qualified healthcare professional.
Couldn't agree more.
Yeah.
Now, before we wrap up, is there anything else you think our listeners should keep in mind? Perhaps something that wasn't explicitly covered in our source material, but is still relevant to this topic.
One thing that always strikes me is how much medical knowledge is constantly evolving.
Right.
What we know today about treating hyperthyroidism during pregnancy might be different tomorrow as new research emerges.
That's a great point.
Yeah.
So how can our listeners stay updated on the latest research and recommendations? Are there any resources you'd recommend?
Absolutely. Reputable organizations like the American Thyroid Association and the Endocrine Society.
Okay.
Those are fantastic resources for evidence-based information. They publish guidelines and patient education materials that can be incredibly helpful for both patients and their families.
Wonderful. We'll be sure to include links to those resources in the show notes for our listener. It's been such an insightful deep dive into the complexities of managing hyperthyroidism during pregnancy.
It really has, and I think it underscores how important it is to approach healthcare decisions with a sense of curiosity, a willingness to ask questions, and a strong partnership between patient and doctor.
Well said. Huge thank you to our listener for joining us on this deep dive into hyperthyroidism during pregnancy. We hope you found it as fascinating and informative as we did. Until next time, keep those brains curious and keep exploring the world around you.